My route was very different. I actually went through school as a nurse prior to entering into medical school. So my background from early days was in medicine, and from day one I was always trying to think, how can we do things better? And that's really what led me into what I do today. One of the frequent questions that I get is, how do you juggle your time between being a clinician as well as being an inventor? And I often say that I don't juggle any of those aspects. They're always on the plate in front of me at the same time. It's really about making innovation part of your life. I think one of the luckiest events that happened both in my professional life as well as life in general was matching at the University of Colorado for residency. When I came here and started training, it became very evident to me that the faculty was extremely talented, and a lot of them were thinkers. As we say, they thought outside of the box. And that also had a huge influence on me. From day one, interacting with a lot of the physicians who trained me, many of whom are still here and are my colleagues today, they were always encouraging me to think, how can we do this surgery better? How can we make this device better? And that really was the launching pad towards innovating in the medical device space. We've had a few of our innovations here that have really surprised us as far as being much more commercially viable than we initially thought. We actually needed a tool that would help us for an imaging study that we were doing. And eventually we realized that could be commercially viable, took it into practice, and it's actually the fastest growing glaucoma device on the market today. One of the things that I love about the Department of Ophthalmology is the fact that we focus a lot of our research on the practical things that we might need for patient care. From day one, when we're thinking about innovating devices, we're always thinking, how can I bring this into the clinic, into the operating room, and how can I influence the lives of the patients that we're seeing every day here in clinic? So I think it's very important the fact that we're mixing patient care along with innovation, and we're constantly thinking between the two, how can I make each one better? One of the keys to successful innovation on campus is the environment that we're in. We have one of the most innovative campuses in the country, and I've traveled all over the world visiting universities that also have innovation as one of their central assets on campus. And I would put the University of Colorado at the top of the list, both inside of the United States as well as internationally. The best advice that I could give any young physician, young inventor, is to reach out to those who have done it before you. I think it would be extremely valuable to grab a cup of coffee or have lunch with any of the colleagues who've done it before, because they can show you a roadmap that might help you save time and resources. The other thing that I would stress is, don't just talk to one person. Make sure that you talk to several people, because you can take the best of each person that you talk to, and at the end of the day, it might result in a pathway that's unique and much better than any of those that you might have explored with any one of those mentors. We have great leadership from the chancellor to the dean to my department chair, who are very supportive with resources and time. And then if you look at the faculty level, oftentimes physicians are having discussions about what can be done better for patient care. The patient is at the center of all of these discussions, but we have building blocks from the bottom as well as from the top at our university. And that's one of the really exciting aspects of being here at the University of Colorado.